Welcome, everyone. Excited to have everyone here. My name is Alexis Plus, and I am the co-chair of the New York State Harm Reduction Association and also the founder and executive director of Truth Farm. And this evening, we are welcoming you to one of New York State Harm Reduction Association's town halls, which we have been trying to have on a routine basis to bring up-to-date information about education and advocacy work that's being done across New York State. And, you know, just make sure that everyone is staying up to date with harm reduction practices and principles. If you want to advance the slide for me, Naomi. We'll give you an overview of what New York State Harm Reduction Association is. Our mission is to introduce and promote harm reduction in New York State as a scientifically based treatment appropriate for substance use disorder, as well as a lifestyle approach to people who use substances. Our vision: harm reduction will be established as the preeminent scientifically based treatment modality for substance use disorder and the appropriate response to people who use drugs. Our activities include providing members with access to cutting-edge clinical and peer trainings rooted in harm reduction. We advocate for policies that make harm reduction the preeminent treatment modality across New York, and we'll be talking a little bit about that tonight in the town hall. And we collaborate with partners working at the intersection of race, gender, and class to end the opioid epidemic. If you want to advance the slide. So we welcome our members who are attending this evening, and anyone who's attending who's not a member, we would invite you to become a member. We have a sliding fee scale for members to join, so even individuals can join. If you're in the using community, I think the membership is $10. So it's a really great way to get connected and have access to really great resources. We had a conference earlier this year, and so there was a reduced rate for attendees to attend the conference as members, and we'll be doing another conference in the future. And then you have access to high quality trainings, our quarterly membership meetings, and all the advocacy work that we do. So let's go ahead. I think that was the last slide, right? Oh, there it is. So there are the fees listed for membership. And as I mentioned, it is a sliding fee scale, and you can join as an organization or as an individual. And we will be increasing the benefits as more members join as well. So we hope that you will join our association moving forward. So here we are with our town hall. And does that slide thing then go away, Naomi, or does it stay up there the whole time?
It goes away.
Okay, yay. So welcome. Here we are, everyone, and we have Assembly Member Steck's view with us as well, which we're excited about. I'm going to let each of the panelists introduce themselves this evening, and I will start with Tracy Gardner.
Thanks, Alexis. Hi, folks. I'm Tracy Gardner. I am Vice President for Policy Advocacy at the Legal Action Center. We're a law and policy organization that works at the intersection of health and justice. We've been around since the 70s, and so we work on fighting discrimination against substance use disorder, HIV, mental health, and people with criminal record convictions.
Nice, thank you so much. And Assembly Member Phil Steck. Oh, you're muted.
There we go.
There we go.
So I'm out of town in Elmira with my daughter, so there's a lot of glare where I'm sitting, but I don't really have another place at the moment. So I apologize for that. Anyway, I represent the town of Colony in Albany County, town of Niskayuna in Schenectady County, and the city of Schenectady. And I'm also chair of the committee on alcoholism and substance abuse in the Assembly.
Thank you so much for being here this evening. And Charles.
Hi, everyone. Charles King. I am one of the founders and the chief executive officer of Housing Works. We've been around for a little over 30 years now. We opened one of the first pilot syringe exchange programs when New York State Department of Health developed the model as a research pilot. Then later, after the MRT process that Jason Helgerson led, we submitted the first proposal to OASAS to use harm reduction as our treatment modality in an OASIS licensed facility, and are really pleased to see that other organizations have adopted that modality and in fact used our policies and procedures manual as a template to replicate. So I'm very excited to be here. One of the founding members, along with Alexis and some other folk of the New York State Harm Reduction Association, and really pleased with how it's grown, and really pleased to be a part of this forum and to see all of you participating here tonight.
Thank you, same. And the last person I'll introduce, because her camera is off, but Naomi Harris Tolson is with us as well. She's a member of the executive committee of the New York State Harm Reduction Association, and we would never be able to accomplish all of the things that we accomplish without her. So she's the power behind this evening and much of the work that we do. And I want to invite, I see that a lot of the folks who are attending are introducing themselves in the chat window. We love that. So please continue to do so. Engage in the chat window, ask questions, chat with each other, and definitely introduce yourself to everyone. It's pretty exciting to see everyone who's here. I see a lot of familiar names, and it's just great to have you all here. So let's jump in. Our goal here really this evening is to talk about what do we need in New York State next in terms of legislative changes for, to advance harm reduction and to save lives. I mean, that's what we're trying to do here. And we're hoping that this is more of a conversation among our panelists than anything else. So I'm not going to be giving questions to specific panelists, but I'll throw questions out there and then let any one of our panelists jump in, and hopefully they will just engage in an exciting conversation in front of us. So just the first general question, and I know that this is really a no-brainer for those of us who work in harm reduction, but why? Why is harm reduction so important to advance in New York State?
Well, I'm more than happy to jump in, unless Tracy, you want to go first, or assembly member?
You start.
So I want to just a little bit of history. I think I'm definitely one of the gray hairs here. When we first started banding about the term harm reduction, we saw it as a singular intervention to stop the transmission of HIV. In the 80s and 90s, about 50% of people who contracted HIV in New York State were contracting it through intravenous drug use, generally because they were sharing either the syringes or other of the paraphernalia associated with it. And so we saw it as an HIV prevention measure, and the chant at the time was "dead addicts don't recover." What we've learned over 30 years of this is that it's so much more than just an HIV prevention measure. It also prevents STDs, it also prevents hepatitis C, but it's so much more than that. It really is a clinical intervention that offers an alternative to engage people in care, engage people in systems of care without dictating to them what kind of behaviors are permissible or not permissible without telling them what the outcomes should be that they are working towards, but inviting them to reclaim their lives and live them with as much autonomy and wholeness as possible. And so if we're serious about following the science, if we're serious about proven interventions, we need to shift away from the old ideas that never really worked and move into a new age where we're offering proven interventions that move people along a path that we call recovery, but doesn't necessarily have anything to do with stopping using drugs or stopping any other particular behavior. Just moving towards living your life whole with a sense of autonomy and self-control.
Love it. Anything to add to that, Tracy or Assembly Member Stuck?
I'm gonna go because Assembly Member hasn't unmuted yet. For me, having grown up in HIV work, harm reduction, and as love is all I know. And so if you love individuals, if you love communities, then harm reduction makes sense because it is about valuing life and it's about non-judgment. And we used to talk about meeting people where they're at, but I have more recently learned that it's really any improvement, any positive action, right? I swear I'm not doing this for her, but anybody who doesn't understand harm reduction and the history of it, please get Maya Salowitz's book. It is really kind of almost required reading to understand the history of harm reduction, which didn't start here in this country, number one. And number two, that we employ harm reduction interventions all the time. Filters on cigarettes are harm reduction. Seat belts are harm reduction. We reduce the harm of things that we're going to do anyway, because we shouldn't die from the things that we're going to do anyway. And unless you believe that death and sickness are what people should be punished with, then life and sustaining life and valuing life is harm reduction. It's great that it's proven clinical approach, but what it allows for fundamentally is to draw people, call people in a non-punitive way, and that embraces their wholeness, and that they can, as Charles said, make decisions about their health and their life. People who use drugs can and do all the time.
I love that. Anything that you'd like to add, Assemblyman Stuck?
No, simply that the Assembly would generally support all of the specific things that you have listed as being what you wanted to talk about in terms of harm reduction. I would point out one thing, because a lot of those bills do not come through my committee. They go through the Health Committee, which I'm also a member of the Health Committee. I think the Senate will become increasingly supportive. It's hard to say about the governor. I did reach out to the governor's office prior to this session. I have a concern that the new governor, though a much more pleasant individual to deal with, and certainly more collaborative than the outgoing governor, that when it comes to philosophy of government generally, I have a concern that they may not be that different based on some of the appointments that I've seen. that may or may not affect this particular space, because where you tend to see that conservatism is on economic issues, such as whether we should reinstate the stock transfer tax, for example, to raise a lot of revenue for the state of New York. Something like safe injection sites is not really in that category. So I think that the advocates in this area probably have a really much better chance of persuading the governor on an issue like that than they would on something like the stock transfer tax, where, you know, she's bringing in a lot of Wall Street people to her administration. So those are my general thoughts.
Oh, I really appreciate that. And, you know, that's what started the whole idea of having this town hall this evening, is the fact that here we have a new administration, and what is going to be different and what is going to be the same. So I think that's a great point to bring up. Is it okay to, yeah, I'd like to ask you a follow-up question, actually. You mentioned, you know, you're the head of the Committee on Alcohol and Substance. I know they've named it Abuse Committee.
Alcoholism and substance abuse, yeah.
Yeah, so a lot of these bills typically don't go through your committee, or at least don't start there. But that's one of the things that I think everyone is interested in doing, is making sure that people recognize harm reduction really is part of the continuum of care. And so how do we help make sure that that even your committee you know, recognizes harm reduction as a part of the continuum of care, rather than being separate?
So I think I run the committee a little bit different than other committees might be run. I'm known to just throw the floor open to the members for discussion. And I think we could invite you at some point to come to a meeting and talk about these issues and just have a discussion. The decisions as to which committee bills go to, though, are made by the speaker. And they're not really made by the speaker personally. As you may be aware, there's an institution in the Assembly called Program and Counsel, and Program and Counsel tends to be institutionally conservative, meaning not conservative politically in the sense of ideology, but institutionally conservative. If they decided 20 years ago that they didn't want to do something, it's often hard to get them to see that times have changed. And if a bill has historically been referred to health, it would be quite difficult, I would think, to get them to refer it to my committee. Further, the health committee has more professional policy staff than our committee does. We don't have any professional policy staff. We use people from Program and Counsel as our policy advisors. The health committee with Dick Gottfried, he has his own staff because he's been there a long time. It's a very important committee, and he's been able to develop that. So I think we can certainly, I think the members of the committee would be helpful for the most part. I think obviously some of the more doctrinaire Republicans might not go along with these trains of thought, but we can try to be supportive of all these things, but and then some of us are also members of the health committee too, so we have a vote on those things.
Awesome, thank you so much for that. And I think that's a great idea. Anytime that we can educate and help people understand how and why harm reduction is a part of the path, the better off we are.
I mean, let me just follow through up on that.
Yeah.
I mean, we could schedule a committee meeting and again, the problem is it's subject to approval by program in council, and I tend to think a little bit out of the box. So they think in the box. So, but I would be willing to have that discussion.
Awesome. We're going to take you up on that. I wanted to start out with a few legislative wins we had this past year. It was actually an exciting session, I think, for a lot of us who have been working on a few pieces of legislation for several years in a row. And some of these pieces of legislation, you know, Charles mentioned syringes, hypodermic instruments, you know, being like the birth of harm reduction back during the AIDS epidemic. And so a lot of these pieces of legislation should have been passed years ago, and people have been working on them for a very long time. But
Can I interject something?
Oh, yeah, sure.
So I recently went to the men's room in Mechanicville, New York at a gas station, and there was a syringe dispenser there.
Yay.
So I thought that was pretty darned interesting, and it surprised me greatly.
That's awesome. Yeah. Yes. So I'll give a little bit of history for some of the folks here watching this evening. Syringes are legal to obtain in New York State. They're illegal to possess. There is an exception to that. If you have a prescription or if you have a card from a syringe exchange program, it supposedly makes the syringes legal to possess. And yet we see people getting these charges for them on a consistent basis. We love seeing the installation of disposal boxes in public restrooms. Of course, it makes complete sense. It reduces disease transmission. People need a way to dispose of those syringes, and it's the safest way to do it, to have those syringe disposal boxes in restrooms. So that's great. But imagine someone spending time in jail or prison for an empty syringe, and that's what has been going on in New York State. So one of the things that we were really excited about this year is that syringe decriminalization actually passed. The Less is More Act passed as well. For those who don't know, well, actually, I'm going to leave it to the panelists, but we had Less is More passed, an opioid lockbox passed, the syringe decriminalization passed, prior authorization for buprenorphine passed. That was eliminating the prior authorizations. And then medication assisted treatment in jails and prisons. So mentioning these pieces of legislation, if any of our panelists want to just jump in and talk about any of these that you think are the most exciting to you, what do you think the next steps are now that they've passed? I know some of them have been signed and some have not been signed. But you know, what pieces of these legislation are you most excited about?
They're all exciting because they're all part of a package. They're all what New York should be doing. The syringe decriminalization is actually the last component of a multi-component piece of legislation called Expanded Syringe Access Program, which was passed by a Republican Senate and signed by a Republican governor. So this will expand the number of syringes that people can possess. And yeah, this has been a process that has been parallel to our understanding that just like a condom every time, a syringe is an instrument of prevention and has to be used each and every time, a new one every time. The syringe disposal was a huge issue back in the day. Legal Action Center actually, as part of our syringe access program, did a lot of work around disposal and the fact that a longstanding public health law allows for syringes to be disposed of at any Article 28 facility. So that's clinics, hospitals, but how to make that happen did require a bit of advocacy with like the hospital associations. And, you know, there are people who have diabetes and other illnesses for which they have to give themselves injections. And so it just makes sense. It doesn't necessarily mean that it's something catering exclusively to people who use drugs that are illegal, but it's definitely overall about responsible disposal of sharps. There's also, so that hasn't been signed yet. The medication assisted treatment in corrections hasn't been signed yet. And as a matter of fact, the current Governor Hochul's staff is doing what is called a chapter, which means the bill has already been passed by both houses, but instead of signing it, they want to make an amendment to it. It will then get passed again and signed per the incorporation of concerns that she has. So that's still in play. Prior authorization in Medicaid, eliminating prior authorization in Medicaid is still in play, has not been signed. There are fiscal implications. As you know, we already have the elimination of prior authorization in commercial insurance. There's no reason to not have it in Medicaid as well. What has been signed is both less is more, yay. And I believe the governor did an executive order to immediately implement it. I don't know why she needed an EO to do that, but so that really has been celebrated by folks working on the despicable overcrowding that's happening at Rikers.
Tracy, could you just take a minute to explain to people what less is more is? I don't think I heard that.
You know what? I'm going to kick that to Alexis because she wanted to, and there are components to it that are both specifically relevant to those of us working around the health issues of people who use drugs, but also some other criminal aspects to it, criminal justice aspects to it.
Yeah, sure. So I'll give a really brief overview. Basically, less is more is a bill that eliminates technical parole violations and also changes the methods that people will be violated, say if they test positive for a substance. So technical parole violations are things like missing a parole appointment, showing up to a parole appointment late. We know people who have been incarcerated for those types of ridiculous, technical violations. The other thing that it does is it actually incorporates a component where if people are, and I try to choose my words carefully because I don't like any of these systems of control, but if people are compliant with their parole requirements over a period of time, they will actually be able to decrease the amount of time that they're on parole for, which is really exciting because sometimes people are on parole, for 10, 15 years. So if they're doing everything that they're supposed to do, all of their requirements based on parole, their time in parole will actually get reduced by that, good behavior. Again, I put it in air quotes because I don't love those terms, but I personally feel that less is more is one of the most important pieces of legislation that has passed in terms of saving lives from overdose, because we know that every time a person is incarcerated, we actually increase their risk of an overdose fatality by 40 times. And we see people being sent to jail here in our area in Broome County for technical parole violations literally weekly. So that's what less is more is. It's a really exciting piece of legislation to have passed. It will impact, countless people across New York State and hopefully reduce incarceration in New York State.
So that was the bill, one of the bills that has been signed that we consider part of the overdose prevention package. And then former Governor Cuomo signed the legislation that governs how the settlement, the opioid litigation settlement dollars will be distributed. And we can talk more about that later. I think, the wonky side of me loves the, it's $1.6 billion over 10 years that's supposed to come to New York. And it can't supplant existing funding and programs. So that means that's new dollars for new and innovative approaches, what I call 21st century approaches to addressing people who use drugs, the risk, and also for people with substance use disorders, where we have a whole system in New York that has basically been constructed to respond to our orgy of mass incarceration from Rockefeller drug laws. And so I think that really represents a big movement. But all of these pieces of legislation go to the elements that make overdose in New York to address the risk of overdose by getting at some of the root issues: access to care, involvement with the carceral system, funding, stability. This is really what New York should be doing. And then finally, I'll just say harm reduction as a embraced and as a recognized service has long been operationalized by the New York State Department of Health AIDS Institute. Charles and I grew up under the development of the AIDS Institute. And so it is not just nationally, but internationally recognized as the place where approaches to HIV and other bloodborne diseases like Hep C have been pioneered. And so developing, whether it was the syringe exchange programs and figuring out a way to get an exemption in the criminal law to allow them, all the way to clean syringe access and any kind of guidance on the development of overdose prevention, safe injection facilities. We have the infrastructure in the AIDS Institute to be able to do that. We don't have to recreate the wheel.
Yeah, absolutely.
I would like to, thanks, Tracy. That was a really great rundown of what we, what was accomplished this year and what is still sitting on the governor's desk to finalize and sign into law. I wanted to take Alexis's invite to pivot toward what's next. And I want to underscore, which is why I wanted to make sure everybody understood what less is more is. And I know Alexis preaches this all the time. The way the war on drugs weaves together our drug treatment system and our corrections, if you will, or judicial system. I hate to use the term corrections because I don't know what's being corrected. So first of all, in that vein, while less is more is a tremendous advance, we also saw over the last 2 years passage of the elimination of cash bail for most nonviolent offenses, and then the restoration of cash bail at the discretion of district attorneys. And so somebody posted in the chat about the case of C.S. Johnson, Izzy, a gay man with mental health diagnosis, who was held. He was arrested for an offense that would not have required anything other than a desk appearance ticket, except that he had a warrant in New Jersey for a misdemeanor. The bail that he was held for is $1. And the technical process of him being able to pay that $1, or even to have that waived by making a formal appearance via video conference, took weeks. And in the course of that time, and I'm sure some of you have read about the various visits that first some members of the Assembly made, and then Attorney General Tish James made to Rikers Island, reporting on its current state of affairs. This young man was crying out in medical distress for days on end and died. And we're still waiting for the autopsy results. The correction said he died of a drug overdose, which just made no sense at all and no basis for it, particularly since other inmates were reporting that he was crying out for medical assistance for days on end. And of course, the family is demanding an autopsy. But this is the sort of vicious cycle that we put people through, particularly people who are using drugs, and especially people who are homeless. And so churning people through correction systems for usually petty offenses that could be resolved in many other non-incarceral ways. And I think for me, that's an important place. We need to go back. Governor Cuomo really beat up on the legislature to revisit the elimination of cash bail, and unfortunately, the legislature kind of caved on that. I don't know if the assemblyman will agree with my description of it or not, but I think that's a very important place for us to start. I also think we need to look at how we treat homeless people and in general, and Housing Works has a whole new campaign around eliminating homelessness, not just for people with HIV, but for all homeless people, and look at the fact that, we have put forward the idea of a stabilization hotel for people who are homeless on the street. That would be harm reduction oriented. Can you imagine one reason why many homeless people aren't going to go into a shelter even in the worst of weather is because they get searched for drugs and alcohol, they get searched for weapons, and what might be for you a useful tool on the street becomes a weapon, a potential weapon when you go through a shelter screen. So we need to make advances in those basic areas. And then there's two more I want to mention, one that Assemblymember Steck already brought up, but one that has been neglected. The legislature approved in, I think it was through a budget initiative 3 years ago, what is called second-tier syringe exchange. And second-tier syringe exchange would allow any government entity, any nonprofit, could be a church, it could be a fire station, any entity to offer, to provide new syringes and other equipment, and at the same time serve as a collection spot for used syringes. And this would be particularly useful in rural counties where we have a lot of overdose, where we have lots of hepatitis C. This would go a long way. So we passed the law and said it's okay to do, but we didn't put any money to it. Now, maybe Assemblymember Steck is right about our new governor. Maybe she's as tight as Cuomo with the purse strings. But one of the things I have to say about Governor Cuomo was he was real big on talk about progressive ideas, but when it came to actually putting the dollars on the table to implement those ideas, that's where he drew the line. And as a consequence, many of his initiatives, whether it's elimination of hepatitis C, ending the AIDS epidemic, if we've made any progress at all, it's been largely despite the governor's actions, not because of them. And I hope to see a change under this governor, and I hope the legislature is filling its oats more to do that. And then last, since you did mention this, Assembly member, is getting approval for overdose prevention centers and actually funding them. We're no longer just asking for approval, we're asking for the state to fund them. And let me break that down for you just a little bit. First of all, Assemblymember Steck is right. The legislation that would allow even a pilot or more broad legislation for overdose prevention centers sits in the health committees in both the Assembly and the Senate. One reason it sits in the health committee is because it is the Commissioner of Health who would have the power to authorize these, just as the Commissioner of Health who had the power to authorize syringe exchanges. So that's where it sits. We had a promise from Governor Cuomo that he would authorize it without legislation. We only turned to the legislature because he flat out lied and backed out of his promise. And so I'm hopeful with the fact that we're going to see a new health commissioner, as announced today, opens the door for a more progressive commissioner who will really champion this with the governor. And Assembly member, I think you're exactly right on this issue. I don't know that Governor Hochul necessarily has a horse in the race. I do know that she was deeply personally touched by a cousin's overdose death, and she comes from the county with the highest rate of overdose deaths in New York State. So maybe she'll be open to it. And I'm hoping you're going to respond to some of this, but before you do, the one other thing I would say in terms of funding, there was always this issue about where does the money come from? Well, we've now got this pool of millions of dollars of opioid settlement fund money. And if there's anything we ought to be using the opioid settlement fund for, is to stop people from dying of drug overdose.
Well, I'd be happy to talk about those things if I can remember all of them. The first thing I want to talk about, because I think it's very, very important to educate folks on this. I'm going to say it twice. There's no such thing as an opioid settlement lockbox. I'm going to say it again. There's no such thing as an opioid settlement lockbox. That bill that created the lockbox and said it couldn't supplant other, existing funding went through my committee, and we obviously supported it. But there's a rule of constitutional law that says you cannot bind future legislatures. And if you think about that, it makes a lot of sense. Every 2 years, the legislature is elected. And let's say in 2 years, the legislature that was elected had a completely different view of the issue and didn't want to have an opioid lockbox. That's a basic principle of democratic government. So of course, under the current array of forces, that's highly unlikely. The other thing is that every time we do a budget, there's potential for those dollars to be moved in different places every time we do a budget. So this takes vigilance. It doesn't just take passing an opioid settlement so-called lockbox. It created a fund where settlement monies could go and put monies in that fund. But in the future, we have to make sure that the money does go there. The legislation doesn't guarantee that. We'll talk a little bit about bail reform. So I'm a very strong advocate of the bail reform. I've actually written an op-ed in the Albany Times-Union in support of the legislation that we did pass. And I do not think it is an example of the governor bludgeoning the legislature. I will get to the origin of that in a minute. But what happened with bail reform is there was a real divide between the city of New York and upstate areas. My constituents would not accept, and we can argue about whether they should or they should not. I will tell you, they will not accept the elimination of cash bail entirely. So what happened was the bail system was reserved for violent offenses. Now that's everybody knows this. I understand it. That's contrary to the purpose of bail, which is to assure someone's appearance in court. It has nothing to do with punishing anyone or the nature of the crime itself. We understand that, but there are different political attitudes in the state, and I thought the legislation that came out was a very reasonable and appropriate compromise between different ways of thinking about bail. And the other
Assembly member, can I just interrupt?
Yeah.
Are you talking about
but I can't forget to talk about the role of the governor. All right. Yes.
But also, if you could, are you talking about the first piece of legislation that passed or the second?
Second. So the first, I actually did not vote for, because in my constituency, you get into technical things of the criminal law, and I want to talk about the $1 bail too, if we can get to that. So so in New York City, where in my grandmother's project, if you go into the what do they call it? Not the foyer, that's in a house. The lobby of her building, and you smash some sort of table or something that's just sitting there, that is technically a burglary in the second degree, because the definition of burglary is you enter a dwelling, which an apartment complex is, with intent to commit a crime therein. In New York City, that's a ludicrous offense to render it subject to bail, right? But in upstate New York, in my district, where people are mostly, not all, but mostly single-family homeowners, they may run the gamut from, working class single-family homeowners to wealthy single-family homeowners. When someone goes into your house when you're not home and ransacks the place, there's no lobby. It's not a trivial matter. People take that very, very seriously and consider it a serious invasion of privacy. So we did, on the revision of the bail law, we wrote it in a way that the first example that I gave would not be a bailable offense, but the second one would be. So there are philosophical disagreements about bail. There's a method to eliminate bail entirely and have hearings on whether someone's a danger to the community or not. There are the federal system in large part works that way. So let's talk about the governor, and this is really, really important. It's not because the legislature lacks the guts to stand up to the governor. It's because the governor in New York has unusual power that is not given to a governor in any of the 50 states except maybe Oregon. Because in 1927, our Constitution was amended to give the governor the power over the budget. And in connection with court decisions, we can't add things to the budget unless we hold out and say, we're not going to pass a budget unless you, governor, add these things. What used to happen is months went by, there'd be no budget, the public got enraged, and so that really isn't an option. We basically need serious reform of our governmental system in New York so we can go back to what every other democracy has, which is legislative budgeting. Let's take bail now. The governor puts things like bail in the budget, which have nothing to do with budget. But because of his power over the budget, it's very difficult, unless you're going to get into litigation or unless you're going to refuse to pass a budget, it's very difficult to overcome that. There are times when I wish we would, pass bills and dare him to veto them. I certainly agree with that very, very strongly. But as I indicated, legislative leadership has not agreed with that. And then let me also make one comment about $1 bail. This is from experience as a prosecutor and as a defense attorney. Usually a judge sets $1 bail where there's another hold against the client. So let's say the client has some criminal offense in the federal system. The judge will set $1 bail in the state system so that the person gets credit for whatever time he or she is serving on his or her state offense, while there is a federal charge also against the person. So it may not have been with bad intent. I'd have to really look at the facts of that case. It may be that, say, just to use an example, the federal hold was lifted and then person never got to court to get the $1 issue addressed, which is certainly, horrible. But it's not really about the amount of bail. $1 bail is usually set to help the person so that they don't have to serve, so they can serve 2 sentences at the same time, and they're getting credit for that.
And why impose it at all?
That's because if you don't impose it, you're not getting credit for time served in the state system. So if you have 2 pending sentences, you might have things from 2 different counties, right? You set the $1 bail for the purpose of making sure that the person is getting credit against both of those crimes. You may disagree with, say, we should have no bail at all under any circumstances, whatever. What I'm trying to explain here is there is $1 bail is oftentimes set with the consent of the defense lawyer to help the person, because if they have 2 pending charges in different jurisdictions, you don't want a situation where they don't get credit in both jurisdictions for the time that they're presently serving. That's what often happens with $1 bail. I mean,
It sounded like earlier that you said something about bail being needed. And I don't, we're supposed to be talking about harm reduction, but bail reform was kind of harm reduction given the number of Black bodies, Black and brown bodies
we
that
supported
end
the
up
bail
in the
reform.
carceral system,
Absolutely.
right? So bail does not, we have never used RORs, right? Return and reconnaissance. And in fact, people always return. There are studies that show people come back for their court dates. And so we have been talking about bail as a reason or as a rationale to get people to come back when they were already coming back. In this case, bail was the ultimate punishment because no prosecutor or defense attorney in New York or anyone who has a barbaric jail system like we have would consign someone to even 15 minutes in that place of torture. And I have loved ones who have been in, I have been inside, I've toured it. I know medical professionals who absolutely had to quit their jobs over, we're not correcting anything as what, Charles said. We're not correcting, we're not rehabilitating. We are punishing and we are throwing people's lives away. So I just need to say that as part of this, if we're talking about harm reduction, we're talking about people that no child should have died over $1 bail. That boy could not be brought to his court date by the correctional system, by the corrections officer, because there is a humane crisis, a humanity crisis going on in Rikers. And I'm sorry to get, passionate
No,
about
I
it.
understand it
but it's-
110%. I mean, you're an opponent of all bail and you believe.
No, I'm not an opponent of all bail, but
Why not?
bailable offenses,
Yeah,
there are judges using bail as a way to punish rather than
and that's
assure
what
that
the
someone
bail
comes back.
reform is designed to eliminate that.
So
But what I was trying to suggest, and I don't know all the facts of this particular matter,
mhm.
but usually $1, I'm just saying that usually $1 bail is not set for the purpose of holding someone in jail. $1 bail is usually set because it's considered such a low bail that if the person gets out on the other pending charge in the other jurisdiction, they will be able to get out quite easily on this charge. Meanwhile, this is why defense attorneys agree to it.
So let me
is
just,
it enables them to get credit for the time that they serve against two different charges, which is very helpful to the defendant, because you don't want him to stay in, or she to stay in jail any longer than they have to.
so let me just add some facts to this case, and I know
Yeah.
Alexis wants to move us along.
Yeah, I don't know if we want to get in the weeds of this particular case. Is it?
Yes, and we should have more than just a couple of non-attorneys. I don't know, Alexis, if you're an attorney. I'm not. I know Charles is. I know Assemblyman Steck is. So that's way too many lawyers. So you know what I mean? Like we should have the people who are actually defending people and seeing how this plays out in real time. And I think that that's a good harm reduction association topic, because there is an overlay.
I'm not trying to defend what happened, which is the mistaken impression. What I'm trying to say is that people who defend people who are accused of crimes often agree to $1 bail for the reason I cited. They're actually trying to help the defendant.
I don't know if my legal aid attorneys would agree to that.
So,
that they would agree. I just don't.
let me make one comment and a suggestion. My one comment to add to the facts of this case is, as Tracy said, we know that our Rikers Island system is falling apart. Corrections officers aren't showing up for work. Gangs are running the floors, and it has proven to be murderous. And so if anybody thought that sending somebody to jail on $1 bail was going to help that person, that thought wasn't rational. And what I would add to it is that he spent over a month in jail trying to get rid of $1 bail before he died. But my suggestion is, because I think we want to get back to some of the other things, is that we do another forum, invite both prosecutor, former prosecutor, invite Assembly Member Steck back, and talk about harm reduction in the context of our judicial system and the laws that we impose on people that have such a negative effect, especially on people of color.
Well, the thing is that everyone agrees with you on that statement.
Okay, except that there is no way to implement harm reduction in this current legal judicial system, because it's built on white supremacy and anti-Black racism.
I agree with you.
We cannot put them together. So there is no harm reduction. There is no love.
I'm actually talking about why we need, if we believe in harm reduction, why we need to transform the system. But I'm happy to have some.
It needs to be torn down and started over. There's no transforming what was made to be punishment and pain for a whole group of people. There is no transforming. There isn't. And I'm not even an abolitionist, but there is nothing we can do with something like Rikers Island, where people are standing 5 to a cell with a toilet running over with feces. That's punishment. That is just punishment. And it's not what we should be doing. So,
well, I appreciate this super impassioned chat. And this is a topic I feel super passionate about. As Charles mentioned, it's something that we talk about all the time. Incarceration is harmful. It's harmful. It's harmful. Tracy put it exactly as it should be put. But let's move on to our question about OASIS, because I think that we could definitely talk about this all night. And I think we definitely need to have another town hall to discuss these topics, because they're so important. And the people that we serve and that we are providing services to are constantly harmed by these systems, constantly. So the work that we do in the community to save lives, to reduce harm, to provide treatment, to provide care is constantly disrupted and really thrown away by the carceral system over and over again. So we'll leave it at that. We'll definitely talk about this another day. It's a really important topic. But let's move on to talk about Oasis, which should get people equally excited. So when we think about substance use treatment in New York, we immediately think of Oasis. For those who don't know, it's the regulatory body for treatment in New York State. Within the past couple of years, Oasis actually rewrote its regulations, which a lot of us were very excited about. It eliminated the words total abstinence from the regulations in terms of how treatment should be provided or being a requirement of treatment. The problem is a lot of us are not seeing this on the ground. It's not being implemented in treatment. And so what are the steps that we need to see our new governor take to truly advance harm reduction in practice and principle at Oasis and within the treatment community?
So I had been going to answer to this question and say we need to turn Oasis upside down. But I think that I'm just going to adopt what Tracy answered for jail. Because the truth of the matter is, when you look at drug treatment across this country, it was built on a white supremacist ideology. And so, Alexis, you named all of the progress, and I'll use your air quotes if I can borrow them for just a moment, that we've made with Oasis. But the fact of the matter is, at its root, whether you're talking about the commissioner or the worker, the state employees out in the field offices, or the vast majority of implementers who are licensed by Oasis, it is an institution that is through and through thick with archaic ideas that really are founded on white supremacy. And this idea that people have to be ready for, even though they change the regs, there's still this mentality. We met with Arlene Gonzalez-Sanchez, the commissioner, not too long ago, and she just so clearly exhibited this mentality that was all about what traditional drug treatment has looked like in New York State for the last 70 years. I think it's been around. And so I Tracy, tear it down. Let's start all over.
Charles, you brought it up earlier, which is our treatment system, which, you say treatment and you think therapeutic, but it has been inextricably linked with the punishment system that we have had. New York has one of the most mature addiction treatment systems in the country. And what I learned when I was at Andrew's house, some of you know that I was in the Cuomo administration for a hot minute, overseeing what they call the O agencies, Office of Mental Health, Office of Alcoholism, and then it was Substance Abuse Services, and Office with people for people with disability, developmental disabilities. And part of that is that these O organizations exist under a legal entity called the Department of Mental Hygiene. We all know the Department of Health, but there is its sister agency called the Department of Mental Hygiene. And historically, in just about every state, mental hygiene has been used to punish other. It has been used to sideline other. It has been used to institutionalize other. We have a robust mental health system inside of our correction system. We have a correction system that purchases and distributes more mental health medication than all of our health organizations in the entire state. We have married crime or the criminal element with that aspect of health. And if you believe that you can treat the mind without treating the body, then you're part of the problem. We have a whole insurance industry that pays differently for the body instead of the mind. And that has its roots in chattel slavery, anti-Black racism, and white supremacy. It wasn't that long ago that Black people in servitude, in slavery, were treated by the veterinarian. We were part of the animal husbandry approach. So we have a problem on the health side, which is that health has rejected everything that has to do with mind health, the crazies, the junkies, and the cripples. That's the joke about the O agencies. Health has abandoned, because of racism in health, has abandoned health issues of the mind to the justice realm. Criminal justice was never supposed to be providing healthcare the way it is. It's an abomination to make it do so, which, you know, as we talk about medication-assisted treatment and corrections, we have to balance that with the fact that we don't want that kind of healthcare being provided in a carceral setting. But we also don't want to consign people to instant death because their resistance has dropped while they've been incarcerated, and then they come out to risk of overdose, or as my Canadian friends say, risk of poisoning, because our drug supply that is illicit is poisoned. If this were Johnny Walker Red and it poisoned, a batch of Johnny Walker Red poisoned somebody, the FDA and all kinds of regulatory agencies would be on that liquor manufacturer. That batch would be called back. They'd be paying settlements. We're talking about the same kind of substances. We're talking about the same kind of substances. Substances that are illicit create a Black market and put people at risk. Substances that are legalized are protected. The quality is monitored and enforced, which is why we're going now into a cannabis environment. But we cannot escape that most of the 93,000 people who overdosed in the 18-month period of COVID were Black and Native American. And that doesn't surprise me, because these are the two populations legally and most persistently oppressed by layers of government, right? And so we have to talk about the fact that there is a reason that Black people are overdosing, and a big part of it is because we have married it to criminal justice. What happened to decarcerating to protect people from COVID in congregate settings? We had 3,300 people in Rikers at one point at the height of decarceration, and now we're back to almost 6,000. And guess what those people look like? So that's not harm reduction for me. We're not doing harm reduction for people who need it. And if we talk about certain crimes, I was hoping that Assemblyman Steck would talk about the fact that Berg 2 is a violent felony with no actual person who is being hurt. It's property. And it could be somebody who is in withdrawal and breaks in. That's not okay, but they are not violent against property. And yes, I understand that the needs of the renter are less than the needs of the homeowner. But then we consign people with a violent felony to a cesspool like Rikers means that we are okay with throwing folks away. I'm not.
Just gonna pause for a minute. Okay. So I heard in order to change Oasis, we need to tear it down. We need to separate it from the punitive system. Is there?
No, Alexis, we don't need to just tear Oasis down. We need to drag the health issues of the mind into the health. There's no such thing as the difference between correctional health and community health when 90% of people go home again. I had a state health commissioner, Richard Daines, tell me during an AIDS advisory council meeting. I asked him if the health department would ever take jurisdiction over correctional health, because our state correction system is its own medical system. And he said no.
Mm. Mm. Yeah.
So I want to point out that it goes even beyond that. Some of you may be familiar with Nishawn Williams. Was a young man, young African-American man, born and raised in the Bronx, spent some time in Brooklyn, but had the misfortune after he seroconverted of moving up to Poughkeepsie, and ended up being the only person in New York State ever incarcerated for essentially for being HIV positive and having sex with women. And I can tell you that race had a absolute key role to play in his plea. And he served his entire term. He wasn't offered the opportunity for parole. Instead, once he had served every single day of his term, he was turned over to the mental health system as a predatory sex offender.
Mm.
There was one conviction of statutory rape. The other conviction that he pled to was not statutory rape, it was consensual. And as based on that, and there was no evidence that any of his sexual relationships were coerced, but based on that and conjured up substance use disorder diagnosis, he has been sitting in a mental health run facility that is a jail, basically. And he's entitled to an annual hearing. The first annual hearing he had kind of ended up getting botched. The second hearing took place just this last summer, 7 years after the first one. So he has now been held in this mental health facility for over a decade with no realistic prospect of being able to get out unless there's a substantial change in his case, because mental health keeps writing these reports about why they need to detain him, and continues to assert substance use disorder, though he's had no access to substances to use for the entire time that he's been there, and no evidence of any use and no evidence of any sexual misconduct, any ideation, and yet a Black man is now entering middle age, locked up with no clear path to freedom, even though he completely served his entire sentence.
So let's get back to, I want to make sure that we leave a few minutes open for questions. I want to remind everyone who's attending, you can type questions in the chat window, or you can type them in the question and answer section. But let's take this all the way back to the title of our town hall this evening. How do we make harm reduction a priority in New York State? What are our next steps? And, any one of you feel free to jump in, but what needs to happen in New York State to make harm reduction a priority?
So one of the things that I'm looking at and I think is very important. And I think politics plays a huge role in this, but I've always been comfortable banging on doors and knocking down walls in that space, is what kind of appointments come out of this new governor. This governor has announced, she's never been elected as governor. She had a fairly close race when she ran for re-election as lieutenant governor. She's announced that she wants to run for a full term on her own this next year. And whether she's fiscally conservative or not, she's got to make some moves that are going to bring voters around to her. Her most obvious potential competitors in a Democratic primary are African-American. So she's going to have to take some steps to gain credibility in those communities. And so that's where I'm hopeful that we have an opportunity to get some new appointments around some of, we obviously are going to have a new health commissioner. I would love to see, even if we're not going to, if she's not ready to abolish the O's tomorrow, to appoint some progressive commissioners who would rethink what needs to happen. And I think Tracy is right that the health commissioners that we've had for as long as I've been in New York have had no real interest in coming together and working with the other O's. Whether they're officially joined as a single agency or are just much better integrated. In fact, I sat on a task force around integrated licensure, and we're right now applying for integrated licensure, and OMH is determined to keep every ancient regulation, separate entrance, separate waiting room, all of their old-fashioned ideas about segregation of people who have mental health issues. So I think we have an opportunity in terms of who the new appointments are. And some of you know, I've been kind of head and feet first, trying to shake up that and bring some ideas to it. So I think that's one thing we ought to all be very much focused on. And then I think we need to be organizing our communities so that our communities are signaling to this governor, if you're going to come campaign for vote in our neighborhoods, you need to take a look at some of these things and make some serious headway.
So I want to make sure that I get an opportunity to ask Assemblyman Steck a question about the opioid settlement issue. But to your question, I agree with Charles about the landscape that the new governor faces in terms of getting reelected. It's been my experience or my observation from my experience that the executive occupies and is fairly untouched by constituency demand unless it's huge. While I was there, I heard that unless a rally was more than 500, nobody even stopped to look out the window. And so let's be clear, because the executive has jurisdiction over the entire state. Legislators are much more sensitive to being influenced and touched and cajoled and supported because they have a smaller, but the executive is almost impervious to it. The second thing is that commissioners versus people who advise the governor on the second floor or in the chamber, commissioners are further down the food chain. So what we also have to watch and continue to watch is who this governor surrounds herself with as her second floor, her operations and her legal, her counsel, right? And we knew a lot about governor's counsel last time with the last governor. We don't know about this council, we will see, but they have powerful roles in advising the governor. So we'll see if those appointments that she's made already and appointments that she will make will play out. I depended on deputy commissioners when I was an assistant secretary because they know everything about the agency. Commissioners can often be decorative or ceremonial, but they don't have to be. And we have other executive examples where commissioners have been given latitude based on their expertise. And I hope that happens this time around. And then the question for Assemblyman Steck is, what is going on with at least the assembly appointments to the opioid advisory group? Because while the speaker is going to, in the law, makes those recommendations, there's no way that he's going to make those recommendations without consulting with you. So can you give us an update on that?
I don't agree with that at all. I mean, I think the speaker may not, typically doesn't make recommendations to panels and consult with members. He may with some, but that hasn't been my experience. I do want to say I agree completely that the governor is flying at 5,000 feet, supported by huge amounts of campaign contributions. And if you look at this governor and think about her reelection, what she's trying to do, it seems to me, is make sure she will be able to raise money from the same place as Andrew Cuomo did. So it's a very negative impact on the system. I think because, again, I would go back to the extraordinary power of the governor, but
wait, are you saying that the recommendations you don't have recommendations for the advisory board?
I do not know, and the speaker hasn't asked me, no. If you have some suggestions, I certainly would be happy to bring them to the speaker, but no, that is not necessarily how things work.
I will most certainly take you up on that.
That's fine. That's perfectly fine. But your assessment of the governor, this is a real problem. And, I tell my constituents, you can see me in my office anytime. If I'm out somewhere having a beer or eating dinner, you can talk to me about the state. I do not mind. I say, try talking to the governor. Try see, how's that going to work for you? Well, we've got a terrible situation where this governor, it's an anti-democratic system because the governor basically is not responsive. As soon as is elected, that's the last responsiveness you get.
I would agree with that. I mean, I've always been blown away that we don't even have a way to email our governor.
Well, I think again,
it's impervious to contact.
We can talk about every single reform in the state of New York, but from a broader overall perspective, until gubernatorial power over budgeting is ended, it's going to be very difficult to accomplish things.
That is
and more, by the way, more and more things are being done in the budget. I don't want to get into discussion of bail reform, but bail reform was done in the budget where it maximizes the governor's influence over that legislation. That had no business being in the budget.
Agreed.
Okay, so I'm going to go to a couple of the questions that we have from our attendees. We have from Justine Waldman. Thank you to the panelists for their amazing expertise in this area. I'm particularly interested in the idea of thiefdoms in New York City, or New York State, sorry, counties being the sheriffs, commissioners of mental health, and addiction. So any comments there from?
I think Tracy is commenting.
Yeah, that was another lesson, is outside of New York City, the counties and the local mental hygiene entities are pretty powerful. pretty unavoidable. And the role of the sheriff as the arbiter of justice, even so, a progressive sheriff can make for a wonderful district in terms of some good ideas. And we've seen that, I think, with Sheriff Apple, who was able to implement some harm reduction approaches in the Albany-Rensselaer region. And then
Very
we've got,
hostile to bail reform. I'll interrupt you there. So
okay,
you can't characterize Apple as a progressive sheriff. Yes, in the
okay,
area,
I'll say progressive on harm reduction.
some issues.
Some issues. And then you had that sheriff in Western New York who literally laughs at the thought of people going through opiate withdrawal in his jails. And so, and we can talk about the NYCLU, New York Civil Liberties Union has been able to get a decision pushing back on not that sheriff or that jail, but another one. And that's another thing that's sad about our quote unquote justice system is that the reforms are almost always through litigation, and lots of people have to get hurt and die, and then the suit is brought to bear. It's also the only other thing that I saw that the state listens to. When you sue the governor, when you sue the state, I'm not encouraging people to do it, but they then are responsive to change.
Right. Yeah, we see that as well. And we see so many problems, I mean, in our county as well, with both our sheriff and then the county health department. And it takes so long to move folks on issues. And then we have the same issues in upstate New York that we have across New York State. You get a county executive who's elected, and if they're, have very conservative values, then everybody that they appoint is very conservative. And so then, even Department of Social Services becomes a branch of abuse, which is really terrible. Another question that we had was from Bethany Medley. Are there any mobile methadone initiatives currently going on? And I think Charles wanted to answer that.
Yeah, so this is actually an interesting one because this arose out of the COVID pandemic when it slammed New York in March and April of 2020. Oasis actually ordered the methadone programs, first of all, to make multi-day supply of methadone available for pickup for everyone, and then to actually set up delivery programs. And here in New York City, the City Department of Health actually set up an entire delivery service. The problem with the program, I think it was great. It was about time it was forced. Far too many people get coerced into having to show up every day, stand online, frequent urine testing, all the rest of this is a part of, again, a very humiliating drug treatment process, treatment in air quotes again. The problem was that they left to the programs to the discretion to decide who could be trusted with the delivery of methadone. Unfortunately, and Vocal fought this battle over and over. It was a huge issue and never did get properly resolved. So technically, mobile methadone is still available because of COVID. I never saw the order rescinded, but far fewer people benefited from it than would have been possible had programs been willing to trust their consumers.
Right, and another race issue, because it is, there are many studies that show that buprenorphine as a doctor-administered, office-based opioid treatment, OBOT, is not made available to Black people with opioid use disorder as it is to white. So we've got to wait for the wagon to get the methadone, and that'll probably be the way that methadone would be available to correctional facilities that are, close to Canada. I mean, how that's going to happen, I think there's a lot of questions, but let's not be fooled, is that we've had a two-tiered treatment system for a very long time. Actually, it was one tier. It was for Black and brown people. And then we had prescription painkiller epidemic. And as far as I'm concerned, white people discovered the addiction treatment system that was left to us through the first opioid epidemic and then crack. And when they discovered it and how inhumane and non-scientific it was, changes have happened in the addiction treatment system in the last 10 years. More changes have happened in the last 10 years that have happened in 40 because of who has been affected, the narrative, and so, it is what it is in terms of racism being as American as apple pie, but let's not be fooled. If we're not careful, we will create another racially bifurcated system.
Without a doubt. I mean, we see that happening still constantly. So we're at time and overtime. I think that what we learned from this town hall is that we need a lot more town halls. I think we definitely need one town hall that talks about that meshing of the systems of punishment with what is supposedly called treatment in New York State. I think that we really need to get at the root of that. We've had some situations here this week at Truth Farm that were really disturbing, and it just seems like it's never ending.
Alexis, could I mention just one other thing?
Sure.
And again, this is about the treatment system and the reliance on the justice system, is that there are people in the addiction treatment system in New York who rely on the carceral system to give them patients.
Mm-hmm.
And that says it all.
Right.
If you have to be viable over the carceral system and the way that we punish people who use drugs, people with different color skin, differently abled, people with different sexualities, then your business model is questionable.
Yeah.
Problematic.
Just to put a point on that, more than 50% of all people coming into licensed drug treatment in New York State are coming because they have been mandated.
Mm-hmm.
I think you're absolutely right. It's a system that is so intertwined and has become so mutually beneficial to the criminal justice system and the drug treatment system that it's almost impossible to entangle. And I would bet Tracy would say it is impossible, and we're just going to tear the whole thing down.
Yeah, I like it. I think what we all need to do is either have a beer or, as one of the people in the question and answer said, pick our drug of choice and get together with Assembly Member Steck. And I think that we could probably talk for many hours about these issues, which what we were hoping would happen is that we'd have an engaging conversation, and we can definitely say that was a success there. I think that we came up with a bunch of topics that we need to host future town halls for. And I was a little concerned sitting here thinking, did our attendees learn what we need to do to advance harm reduction in New York State? I think that what we can conclude from this panel in this town hall is actually makes me feel like crying, but I think that we're so far from where we need to be in terms of delivering harm reduction based care across New York State, whether we're talking about treatment or healthcare services, which should be the whole body, mind, brain, everything. But we're really far from having a harm reduction based system in New York State. I think that that's what we can conclude from this town hall. So thank you all for attending. I hope you'll attend the next, which are, I'm certain, going to be pretty explosive town halls as well. And I really appreciate the panelists who were willing to come tonight and have this very engaging and exciting conversation. So Thank you all.
Thank you. Have a
Thank-
great evening.
You too. Good night,
Thank you.
everyone.